Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
When our pets aren't feeling right, we all get very concerned, especially because they can't tell us what's wrong with them. Sometimes it's something minor, but other times it's more complicated. On today's show, we will look at our pet's health from common urinary issues to other elements that are more serious, and we will share tips on how to keep your pets in their best health. And as always, we are here to answer your questions. All that and more coming up on this episode of Ask the Doc, No Appointment Needed. Hi, and welcome to Ask the Doc, No Appointment Needed, the health show where you send in your questions and they're answered by our doctors and medical experts. I'm Dr. Joy Carter, doctor in veterinary medicine, and thank you so much for joining us today. Let's get right to our questions. First question comes from Virginia, who emailed us and asked, how small should I cut human blood pressure medication for a dog? What about allergy pills? Virginia, thanks so much for writing in. Okay, so first of all, the question that I need to ask is, was this prescribed by your veterinarian? All right. There definitely are some human medications that do cross over to animals and that can be used in animals. But you need to make sure that this was prescribed by your doctor because obviously blood pressure issues, just like in humans, can be serious in pets. But if your pet doesn't have an issue with their blood pressure, then you don't need to be giving them the medication. Your veterinarian will tell you, okay, what milligrams, what medication, obviously, and what size tablet, whether it's a whole tablet, a half a tablet, or a quarter of a tablet. And if it is a medication you can pick up from the local pharmacy, your vet's going to have it on the script as far as what the dosage is going to be. Now, as far as allergy medications are concerned, definitely there are a lot of allergy medications that we use in humans and we use in dogs. The most common one is Benadryl. It's a pretty safe medication. Typically, the dosage for Benadryl is going to be around 1 milligram per pound, okay? Definitely, I still do recommend calling your vet if your pet is itchy, saying, hey, my pet is itchy. Your vet may tell you, hey, you can give some Benadryl for now. Let me see about scheduling you for an appointment, okay? But always follow their recommendations. And if for some reason, if your vet is closed and it's after, hours, you're welcome to call one of the Veg ER for pets, the emergency hospitals, and you can speak with the doctor and they'll be able to instruct you on what to do. So Virginia, please, unless your doctor has been prescribing the medication, don't, be cutting up the pills. Check with your vet and they are going to give you the proper recommendations. All right, the next question comes from Jordan, who emailed us with his concern for his newest family member and asked, hi, Doc, I just adopted a new male kitten, and my friend told me that male cats can have urinary issues that can be life-threatening. What is he talking about, and what can I do to prevent this? Thanks for your question, Jordan. Before we get to urinary issues in male and female cats, it's important to know the warning signs. All right, Jordan. So I'm going to go ahead and we're going to start talking about this because this is one of my favorite topics. So what you're talking about is called a urethral obstruction, okay? Or sometimes people will call it a blocked cat. And it's just as you see on the screen, these are a lot of the signs and symptoms that you will notice. In particular, with blocked cats, usually they are going to go to the litter box and try and urinate and nothing comes out, or either be crying like they're in pain, or they may go to the litter box and just dribble a little bit of urine. It is 100% a medical emergency. And if you notice that, you need to call your vet right away. You need to bring your cat in. If your vet's not open, it's after hours, you need to go to an ER, okay? The reason why it's life-threatening is because if they can't urinate, they can't get toxins out of their body, okay? And that can cause their kidneys to shut down. And on some very severe cases too, their bladder can sometimes rupture. All right. Now, typically the reason that cats get blocked are three main things. It can be because of a mucus plug, it can be because of blood clots, and also it may be because of like sediment, grit, or what we call so-called kind of crystals that they can get stuck in your urethra. Unfortunately, male cats do not have a very large urethra, so it's very easy for them to get blocked. If they do get blocked, typically they're sedated and they are unblocked, and then they put a indwelling urinary catheter in for a couple of days, okay? And they leave that in place and put them on IV fluids to be able to flush the bladder out. Now, the thing you can do to try and prevent this from happening, if it does occur, is usually with a prescription urinary diet that your vet will recommend it. It's not always 100%, but definitely having them on a urinary diet can help prevent them from getting blocked again, because they can get reblocked. I kind of say now, it used to be 3 strikes, you're out. Now I say 2 strikes, you're out, as far as getting a surgery called a PU, or a perineal urethrostomy. Okay. It's actually a surgery that I love doing, that I know how to do. And I've actually did one earlier this week on a blocked cat. It was his 3rd time getting blocked. But basically what they do in that surgery is kind of turn your boy cat into a girl cat. So you kind of amputate the penis and you open up the urethra to its widest point. And that way, hopefully they don't get reblocked again. All right. Hopefully that doesn't happen to your male kitty. If you do suspect any urinary issues, or if you notice him straining or having trouble going to the litter box, then definitely call your vet immediately or take him to the ER, okay? Because it can be very, very, very serious, all right? Thank you so much for that question, Jordan. All right. Our next question comes in from Joey, who also has a concern for his cat. And he writes, we have a young male cat who is not neutered yet. And he recently started doing this weird behavior where he puts his rear up to the wall, flicks his tail, and sometimes urine comes out. It's really upsetting my mom. And if he doesn't stop, my mom is threatening to give him away. What is he doing and how can we stop it? All right, Joey. So this is a pretty easy fix. So what your cat is doing is he's spraying or marking his territory, okay? And the reason he's doing this most likely is because he is not neutered yet. He is still intact. So definitely go ahead and see about calling your regular veterinarian or talking to one of the humane societies or animal services and get him neutered. I would say 99% of the time that will fix the behavior, okay? Sometimes though, I have had male and female cats that have been spayed or neutered, and they still will spray. On those cases, sometimes there are some behavioral drugs, what we call fluoxetine, also known as Prozac, that we can put cats on, especially for urinary behavioral issues, to try and do that. But honestly, I think if you get your kitty cat neutered, that is going to take away that behavior. And please do it ASAP, because I don't want your mom getting any more upset, okay? All right. Our next question comes from Miguel, who reached out to us via Facebook. And he writes, my female cat urinates outside the litter box, even after I just cleaned the litter. I thought she was just being spiteful, but can this be a urinary issue? All right, Miguel. Yes, it can. Okay. So there is something in cats we call FLUT. It stands for feline lower urinary tract disease. Okay. And there's a bunch of different conditions that can kind of get grouped into that. But definitely one of the things that you can see with different urinary issues is you can see inappropriate urination or urinating outside of the box. Okay. So the best thing for you to do is take your cat into your regular vet and get a checkup. They're more than likely are going to probably want to run a urinalysis, which is they take a sample of urine and they're going to check it for things like bacteria, red blood cells, white blood cells, glucose, crystals, anything like that that's not normally found in the urine. They may or may not want to do kind of a quick ultrasound to look and see what the bladder looks like, if the bladder wall looks thickened, if there's sediment in the bladder. Sometimes they'll take a radiograph to check for bladder stones and things like that. But you want to rule out that there's not a urinary issue first, because a lot of times it is that, okay? Your cat may be having a urinary issue and it's painful for them to urinate. And a lot of times cats will do avoidance behavior. So what that means is if they go to the litter box to urinate and it's painful, they'll start to associate that litter box with pain. And so then they'll start using, the bathroom outside of the litter box. So a lot of times with these guys, it's typically not a urinary tract infection. Okay. Everybody's like, oh, my cat has a UTI. less than 6% of cats that present with urinary issues, whether it's urinating outside the box, blood in the urine, straining to urinate, leaking their genital area, less than 6% actually have a urinary tract infection. Majority of the cats have something called idiopathic cystitis. It is just a fancy word for inflammation of the bladder, and we do not know what causes it. We think that maybe it is stress induced. For some reason, cats, when they get stressed out, their bladder is an organ that tends to manifest. So definitely there are some things besides urinary diet, besides medications to help with pain and inflammation, but even some things to try and decrease their stress. It's called like environmental enrichment, and your vet can talk to you about that and stuff more. But definitely, Miguel, go take your kitty cat in, okay? If for some reason everything seems clear with her urine, there's no indication of any type of urinary issues, then it could be behavioral, but don't give up yet. Like I mentioned in the last question, there are medications, in particular fluoxetine, that are really good for cats that want to urinate outside the litter box. And I have used it on some patients, and they've actually responded very well to it. So hopefully that answers your question, Miguel. All right, Sonia followed up with her email and she writes, my sister's dog had to have surgery for bladder stones last year. What exactly are they and what causes them? All right, so this is a good question. I had a dog yesterday that had a bunch of bladder stones. So basically, bladder stones, think of bladder stones like rocks, okay? There's basically calcified minerals that form in the bladder of dogs. Now, the big problem with this is certainly they can cause some issues because no one wants to imagine having rocks kind of rubbing around on the inside of the bladder. So they can cause a lot of inflammation. They can definitely cause pain. They can cause blood in the urine, predispose you to urinary tract infections. And in particular, in male dogs, and less common in female dogs, but you can still see it, as they can cause something called a urethral obstruction. So those stones, when a dog goes to urinate, can pass into the urethra and they can get stuck. And just like a male cat can get blocked, a male dog can also get blocked. I had a poor dog yesterday who had been partially blocked for over 6 months. They finally did a radiograph with me yesterday, and he had stones all throughout his bladder and stones all throughout his urethra. The good thing is that I was able to pass a urinary catheter and flush those stones back into the bladder. And then I recommended a surgery called a cystotomy. Okay. That is a surgery where you go in and you basically make an incision in the bladder and you remove the stones. Now, as far as bladder stones go, there's 3 main types that you see. There's calcium oxalate, there's struvite, and then the less common of the 3 is going to be your urate stones. Your urate stones you do tend to see more in certain breeds of dogs. Dalmatians is one, English Bulldogs is another, and then Yorkshire Terriers is the other one. All right. As far as trying to prevent bladder stones, I mean, if your pet has a history of having crystals in its urine or predisposed to forming bladder stones, there are some really good prescription urinary diets to try and help that out. Struvite stones can be dissolved with diet. The only concern with them is a lot of times, though, it can take a while for the diet to work. And by that time, they can start to have urinary issues such as getting an obstruction, and you don't really have time to wait for the stones to be dissolved. Unfortunately, calcium oxalate stones cannot be dissolved. Okay. So if your dog has that type of stones or a history of having that type of stones, the only thing to do to get rid of them is going to be the surgery. So I'm so sorry, Sonia, that your sister's dog got bladder stones, but hopefully everything is fixed now and she's got her dog on the proper urinary diet to try and prevent this from happening again. Okay. So Marquette emailed in with a question many of us can relate to, and she writes, what is the truth about giving dogs table scraps? I may or may not have given our pups some people food from time to time, and my husband gets mad at me. All right, girl. Okay. So, tell your husband not to get too mad, but yes, your dog doesn't need table scraps. It doesn't need table food. Okay. Maybe a little, sometimes plain chicken and white rice is really good for them if they're having some tummy issues, or even just mixing a little bit of plain cottage cheese. But really, honestly, what you're eating, they don't need to eat. As long as they are on a good, nutritious, complete diet, dog food is perfectly fine. My last dog lived to be 18 years old, okay? And she was very healthy, just started to have some kidney issues at the very last stages of her life. And she was on dog food, okay? She was actually on a good quality dog food. So that is all your dog needs. Now, some dogs, if you give them some human food, they are perfectly fine. They don't have any issues. They literally have a stomach of steel. These are things like your golden retrievers and your labs and your pitties, and they can just eat anything and it never cause any problems. But unfortunately, some of your smaller breeds of dog, they eat something they're not supposed to, and they can get serious medical conditions like acute hemorrhagic diarrhea syndrome, pancreatitis, all of that not so fun stuff that can cause you to spend a lot of money at your vet or at the emergency hospital. All right. So I'd say better safe than sorry. Don't give them any table food because you don't know which dog is going to have a sensitive stomach and you don't know which dog is going to get sick. And trust me, we see it all the time in the ER. I would say probably Thanksgiving and the next would be like July 4th are our most common holidays that pets come in that they have gotten table food because everybody, abuela wants to sneak a little bit of food to the dog because she feels so sorry for him. So just definitely stay away from people food. Okay. So tell your husband though, not to get too mad at you, but definitely don't give any more people food. Our next question comes from Shelly, who has a question on behavior. And she writes, Dr. C, we adopted two beautiful dogs from a rescue shelter. They are great with one exception. The dominant one barks at everyone who comes over. I know she's just being protective, but what can we do to change the behavior? All right, Shelly. So, if the behavior is really, really bad, I definitely would recommend looking into speaking with a dog trainer, or they are actually board certified veterinarians who deal with behavior issues. Okay. Actually, I think there may be one in the Coral Springs area, and there may be some other ones around South Florida. So that's one option you can try. The other thing is you want your dog to associate new people as not something to be scared of. So certainly I would recommend maybe when you have visitors come over for them to maybe give your dog a treat or maybe play with like a favorite toy or something like that for a few minutes, if possible, just so they can associate that a new person in the home does not necessarily mean that it's a bad person. All right. And it definitely may take some time. Another thing that you can do is getting your dog out if your dog is friendly enough to be around other dogs and other people, is just getting them out to dog parks and other places where they can socialize. I would say majority of places in South Florida tend to be very pet friendly, and everybody loves dogs, and so certainly if you bring your dog out and it interacts with other people, hopefully maybe that will help her a little bit associate that new people, are not something bad. And honestly, she probably is just being protective of you and being protective of the home. And she does it in good intentions, but I completely understand a barking dog, when your friends come over is not something that you want to deal with. So hopefully these tips and tricks are something you can try. And if not, like I said, I do recommend getting a dog trainer that can, help you out with your problems. All right, back to your questions. And we just got a question from Johnny, this time from our Facebook page. And he writes, my dog goes through ups and downs. Sometimes he eats like he's starving, and other times he won't touch his food. Is it the food or something else I should be worried about? All right, Johnny. So it's not necessarily that there's anything wrong with your dog, but I would recommend calling your vet, see about bringing your dog in and getting a general checkup. Okay. They're going to do a physical exam. They're probably going to want to run some blood work on them, things like that. It's like people. Sometimes we're really hungry and sometimes we're not. Okay. Unfortunately for me, I feel like I'm really hungry all the time, but that's a whole nother story. But anyway, the good thing is it's not always something that's serious. Your dog just may want to not eat that much for today. And also too, if you have recently switched the food, the flavor, things like that, that can certainly affect their appetite, depending on if you took them for a long walk or they were very active for that day. I know when I'm more active, I'm more hungry. So then maybe they might want to eat more that day. If they're just kind of lounging around and just being a little bit lazy, they may not want to eat too much. So it doesn't necessarily mean anything is seriously wrong with your dog, but the best way for you to know that is to get an appointment with your regular vet and see about getting a checkup and running some blood work and maybe some other lab tests. All right. So try not to worry too much, Johnny, but call your vet and let's go ahead and see about scheduling a general checkup for your dog. And hopefully everything checks out okay. All right. Next, we turn to Althea, who has a question about her dogs. And she writes, we have two cats and two dogs. One cat always tries to get to the dog food, and one dog tries to eat the kitty food. And both dogs like to eat the treats from the cat's litter boxes. Yuck. How dangerous is that for them? All right. Okay, Althea. So, it's really not dangerous. All right. Unfortunately, dogs will eat anything, and cat poop is one of the things that is included. Now, we think a lot of times they like to eat the cat poop because there is typically more protein in a cat's diet. Okay. Cats cannot be vegetarians. They need to have protein in the diet or they can have very serious health consequences. So, a lot of times we think the dogs like the poop because there's a higher protein content. All right. Now, something you can do to try and get them to not eat the poop is there is a type of powder. It's called Forbid, and there may be some other ones on the market, but literally, whoever's poop they're eating, you want to sprinkle it in the food. So if they're eating the cat's poop, then you want to sprinkle it in the cat's food. If they're eating their own poop, you want to sprinkle it in their poop. It is supposed to deter them. I don't know how, but it's supposed to deter them from eating the feces of other animals or from their own. Now, as far as your cat eating dog food and your dog eating cat food, it's not ideal, okay? Is it a life-threatening emergency? Absolutely not. It's just like I said with the whole table scraps issues. Some dogs can have a very sensitive stomach, and certainly them getting into cat food can certainly cause them to have some gastrointestinal issues. And the same thing with cats. Cats, unfortunately, they will throw up for any reason. You look at them the wrong way and they will throw up. So especially if they eat dog food, sometimes that can cause some stomach upset. If you're really concerned about, your pet having some type of nutritional deficiency, which is typically not going to be the case, or some other medical condition, just call your regular veterinarian and schedule an appointment with them to get them checked out. Okay. And if you can, try and keep them eating their own food. But if they sneak a little bit of the cat food or the cat sneak a little bit of the dog food, try not to worry too much. Okay. It's going to be all right. I promise you. Okay. All right. Penelope emailed in with her question and she writes, I got a kitty from the local shelter and she is such a little sweetie, but when people come over, she hides and won't come out for hours. Is there anything I can do to help her get used to people? All right, Penelope. So, unfortunately, your cat just may not be a people person. All right. Like I mentioned about the other question with Shelly, things you could try and do is maybe have when people come over, if your cat has a favorite toy or something like that they like to play with, like those laser lights or the little feather things, maybe have your company get that out and try and play with the cat. Certainly, maybe offering some treats like churu. Cats really love churu, things like that. Those are things you can do. But honestly, don't force your cat. If your cat wants to go and hide while you've got company, let your cat go and hide. That is where they feel most comfortable. Okay. Imagine if you were put in a very uncomfortable situation, you were scared to death, and someone made you come out and sit for hours with someone you didn't want to talk to. Okay. That's just going to stress you out even more. Every pet is completely different. My cat at home will literally love you to death. And I have friends' cats that as soon as I come over to their house, they are gone. You are not going to see them. And that is okay. Like I said, pets are just like people and they all have different personalities. Okay. So there's nothing wrong with your cat wanting to hide. So there's things you can try, but you know what? If your cat wants to stay away from people, that is fine. Definitely let them stay away from people and don't force them. All right, let's keep it going. I think we got time for one more question, and this is from Chase. My dog is 12 years old. He always loves jumping up on the couch, but lately he started favoring his back paw and won't jump. Is there anything I can give him or anything I can do to help him? All right, Chase. So first thing is you definitely want to make an appointment with your regular veterinarian, okay? Your pet is 12 years old. He certainly could be dealing with some osteoarthritic issues. Other things that could possibly be going on, especially if it's a back leg, dogs can tear their ACL just like humans can. We call it the cranial cruciate ligament in dogs, but that is certainly another possibility. I highly doubt that he has like a fracture or a luxation because they tend to be severely lame, like not wanting to put any weight on the leg at all. But still, your vet may want to certainly see about doing some radiographs. That's going to be the best way to look for any issues with the bones as far as osteoarthritis and things like that. The good thing is if your pet does have some arthritis, there are some newer medications and things like that out there. The new thing that we're seeing with dogs is called Librela, and I talked about this on the episode with senior pets. It basically is a monoclonal antibody that it goes against something called the nerve growth factor, okay? The nerve growth factor is what is responsible for the pain response with osteoarthritis. So basically this injection blocks it. The other thing is a newer medication called Galliprant. It is a non-steroidal anti-inflammatory drug that is very safe for older pets. and they can be left on it long term. Acupuncture is something that we're starting to do in dogs now. There's actually veterinarians who do rehab, different things like that. So you've got a lot of options, for your pet as far as if they do possibly, have osteoarthritis. So don't feel like you need to give up. But the best thing is going to be for you to see about calling your regular vet, okay? And see about getting those x-rays done. Because without doing the x-rays, a lot of times we're just guessing. And there can be some more serious conditions like older pets can get cancers of the bone, okay? So hopefully that's not the case with your dog and everything's okay. But definitely you want to go ahead and get an appointment with your vet. All right. All right, guys. So we answered a lot of questions. Unfortunately, that's all the time we have for today. And thank you guys so much for joining us. I'm so glad to be back. And once again, I am Dr. Joy Carter, and I will see you guys next time on Ask the Doc, No Appointment Needed. Ciao. Stay safe and be well, everyone.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.